Well, the most important finding from this study is that the number of deaths from COVID-19, the coronavirus pandemic, that we hear on the news is an undercount. By our estimates, they account for only 2/3 of the excess deaths that have occurred from the pandemic. And there's several reasons why there may be this undercount. Some of it may be due to underreporting. It takes a while for some of these data to come in. Some of it might be because people who died of the virus died of complications from heart disease or other causes, and the cause of death was misattributed to those and not to COVID. But a third possibility, which is the one we're quite concerned about, is what we would call indirect deaths. These are people that actually have not been infected by the virus, but are dying from other causes because of the spillover effects of the pandemic. So an example would be somebody who has chest pain and is scared to call 911 because they're afraid of the pandemic. They're afraid of getting the virus. Or somebody who is in respiratory distress from their asthma or emphysema and is rushed to the hospital and needs to get on a ventilator, but all the ventilators are taken. So in acute emergencies like that, people could have died from other conditions. There are chronic diseases like cancer and diabetes that also could cause deaths that among people who've not been infected by the virus. And we can't forget about mental health. A number of people struggling with depression, addiction, and very difficult living conditions with the economic shutdown may have found themselves in desperate situations and committed suicide. People addicted to opioids may have overdosed. And so what we're seeing is, all told, an excess of deaths beyond what we would normally expect for this time of year that are not fully explained by COVID-19. The message of our study is that we want people who have the warning signs of stroke or chest pain or other signals of urgent diseases to not be reluctant to call 911 and ask for help. They are much more at risk by not getting emergency care than by going to the facilities and receiving care. But it also means that people who are struggling emotionally with losing their job, losing their income, housing insecurity, what have you, have resources to turn to for help in dealing with their depression, their anxiety, their addiction. And that means public officials need to be thinking about behavioral health care and ramping up their services for those patients in need.
There's no question that many people avoided hospital care, preventive care, outpatient care, any contact with any healthcare facility, and sometimes even their healthcare provider, because of fear of COVID. And that had disastrous consequences in that people didn't get the acute care they needed and didn't get a lot of the preventive care. So this is not just over now that things are sort of, people are coming back to the hospital. I think we're going to continue to see the effects of people really being entrenched at home and not seeking the care for routine things or emergency things over the past couple of months. The consequences of avoiding seeking care when needed or continuing with their preventive care really is resulting in significant health problems. Many of them can have long-lasting effects, if not result in patients dying.